What are some of the trends, innovations, new technologies that you're seeing that are, cutting edge, fresh out of the oven, something that practices or just the space in general should be more aware of? Can be AI related, doesn't have to be, but anything that you've seen that you would like to spread the word about.
I'm very predisposed to any sort of wearable device. I love sort of the next generation of maybe it's a continuous glucose monitor or something that allows the person to have some visibility into their own health data, right? I've tried Whoop, I've tried the Aura Ring. I had a great experience with both of those. I don't have a wearable that I'm using right now, but for us and for a lot of our clients, I think it is really beneficial to see and track progress where you can. And you mentioned that's a theme of this conversation. So we're seeing wearables and wearable sensors that even just help someone, uh, you know, track their gait and how that's changed over time as it relates to a therapy, or maybe they have a goal of becoming a bit more fit and moving a bit more, and so that sort of thing that allows you to both be accountable to yourself, in some cases accountable to your provider, if they have access on the back end to a platform that you collaborate on. That's something that's very helpful in certain cases. An example I'll share with you is we worked with a client who developed a sensor for a prosthetic device. And the founder had a glucose monitor, and monitoring his glucose levels he found to be very inspiring, to eat healthy and to have great practices just in his own exercise. And he applied that to his 25-year career in the prosthetic space and developed a sensor that both tracks someone's daily movement, gives uh, the folks on the clinical side an idea of actual utilization of the prosthetic, which before there really wasn't any insight into. And so for someone who is, maybe a bit less mobile than they'd like to be, it's a great way to track your progress and see growth. And for the client or for the clinical side of things, it's a great way to truly understand and have that objective measure of, hey, our prosthetic is comfortable and our patient is wearing it.
Okay, so the kind of data it collects, I'm curious about this. So it collects like how much the prosthetic is used. What other data is in there?
So, as just speaking generally, I think what's exciting is things like wear time and total mobility measured in things like steps. But you can also measure things like variable cadence, where you're thinking about, hey, is this step and this locomotion something that we would expect? And is the prosthetic working correctly? And you can start to really dive into, okay, maybe something changed and something broke here because we have a massive change in the variable cadence week over week or something like that. Other things that you can measure, outside of that specific example, we worked with a client who did some fall detection, right? And I think that's recently been added to the latest generation of Apple Watch. So it's exciting
I
to
heard about that.
see, you know, new fall detection technologies on the marketplace in a system that everyone's familiar with.
Okay, that's really fascinating. I mean, I've got experience, direct experience. I've got one of these wearable devices
Oh,
myself.
nice.
um, with tracking my data for my own purposes, for me tracking my own health, etc. But what you're making me aware of, and maybe some of the listeners too, is that this data can be also used by your provider, by a practice you're attending, and that's so much more useful. At least the way I'm understanding it. That's so much more useful compared to you just coming in one day, checking in with your doctor, and them asking like, so how has it been? And it's all really anecdotal. It's really
It's
it's
not
based on your
objective.
own. Yeah, yeah, exactly. It's subjective based on recollection. It can be even influenced by your mood on a certain day, right? The way you talk to your doctor, and that's all they have to go. That's all they've got to inform, their next recommendations. If they've got some hard data, I believe that can improve outcomes.
Absolutely.